Sculptra is not new. It's been available since 1999. However, in the last few years, it's really gained popularity, and that's why we need to clarify certain facts about the product. Some believe that Sculptra is a filler like hyaluronic acid, but it is not. It is not technically a filler. Sculptra is composed of tiny crystals of something called poly-L-lactic acid. Poly-L-lactic acid is the same as suturing material that's used during surgery for stitches in the body, and therefore it is very safe. It is inert, so it doesn't react with the body. Fillers, basically hyaluronic acid fillers, are simply bulking agents. They are used to restore lost volume. With Sculptra, basically the tiny crystals of poly-L-lactic acid are suspended in water, sterile water for injection, and they are injected in various areas of the face. Therefore, they cannot and do not give us an instant volumizing effect. Their results occur due to stimulation of collagen. So Sculptra, or poly-L-lactic acid, is one of the most powerful collagen stimulating agents we have. The injections have to be repeated, typically once every 6 to 8 weeks, to achieve the desired effect. Nowadays, many believe that Sculptra is simply for skin firming, and that is true, especially since poly-L-lactic acid induces very high levels of type 1 collagen in the skin. Sculptra, being a powerful collagen stimulator, yes, it will increase resistance of the skin. It will reduce laxity and firm the skin. However, one must be very well aware of the fact that when we repeatedly inject the same areas, especially in larger volumes of our suspension in certain areas, it will lead to volumizing. And this is the reason why we have to be very cautious in terms of the way in which we inject and where we inject the suspension. And hence it's important for patients to choose a practitioner who has a good sense of aesthetic, who knows the technique very well, and who can predict the outcome of these repeated injections. The reason why we need to be extra cautious when injecting Sculptra is because if at any stage we get overcorrection, that means we get too much volume, it's not possible to reduce the volume like we do when we inject fillers. So we cannot dissolve Sculptra or the effects of Sculptra like we can with hyaluronic acid fillers. Many people ask how many sessions would one need? And to be honest, there is a little bit of misinformation in this regard. We can only calculate the number of sessions as a ballpark based on the person's age. We know that typically the older a person is, the more sessions they will require. So the way we calculate it is 1 vial of Sculptra for every 10 years or decade of a patient's life. So typically if a man is 40 or a woman is 40, then she will require 4 sessions spaced every 6 to 8 weeks apart. Once the course is completed, for maintenance of the results, we advise a single vial or a single session every year thereafter. We have seen the emergence of other PLLA or poly-L-lactic acid products on the market. So why Sculptra? Most importantly, most of the studies done in the scientific literature and published in medical journals have been done using Sculptra. So that makes it very safe for us to use. We know what to expect and we know what's the long-term outcome. So far, we do not have many studies on the other products based on poly-L-lactic acid. Sculptra injections should form part of any anti-aging program. They can be adopted along with energy-based devices, which also, by the way, induce high levels of type 1 and type 3 collagen for that matter. So these two treatments work synergistically. They work together and they compound the anti-aging effects of Sculptra.